the old cliche that you don't know what you don't know. It's so true, and it's so true it applies to all aspects of life, especially in dentistry, but then it's a practical subject. What I find is that I'm looking every day on the social media about digital smile design and digital manipulations and digital this. It's all very good, it looks great on the screen, but how reproducible it is actually in the patient's face, it's another thing. See, the face is dynamic, smile is dynamic. You have a whole lip movements, whole facial expressions. And you can't just simply devise things that's actually going to be working. You're able to relay what's on the model, on the image, into the patient's mouth inaccurately. It can work when we're doing surgical guides, etc. That's a different question. But that's about putting a plastic that's milled, etc., that fits right, which you all know that, and creating surgical guides. But when it comes to aesthetics, okay, the amount of tooth display, the lip support, lower facial support, the occlusal vertical dimension, that is not simply done on a computer. You need to test the system. To be able to test the system, there are many ways of doing it, and we are going to teach you. There are certain philosophies of treatment that are not new. They've been around for the last 70, 100 years, that have been tested in the system. The trouble is everyone's trying today is trying to reinvent the wheel. Okay? You can reinvent the wheel, but as long as you roll that wheel in the right direction. What I say today is a lot of the information that's supplied on the social media, okay, is everyone's best dentistry that's highly digitally modified. Okay? And what is the average dentist going to think who wants to get it in their life? They'll never achieve that clinical outcome because it's not real. It's actually not real. What we teach in this course is about real smile design, how to achieve real results predictably in every patient, every case. When I talk about real smile design, where you do the direct composite mock-up on a patient, we teach you how to think. That applies in your composite veneers, porcelain veneers, full dentures, like removal prosthodontics, partial dentures, okay, implant reconstructive work, full mouth bridges, all aspects of dentistry, because you are in control. Remember one thing. Here's the dentist, here's the patient. Behind the dentist, you have a lot of people. You have the dental supply companies, you have the dental technician, you have all the marketing media. Everyone else does their job and then leave you. You are the person who's responsible for that patient. You need to understand that you own the problem to be able to transfer your clinical skills to the patient. So, understand that important concept. Everybody else has done their job, moved away from you, and you need to have the problem. So you better get it right. In order to control the problem, to get it right, you need to learn how to correct diagnosis. And when we talk about digital manipulation, let me tell you one thing. Aesthetics is not about mathematics. It's biology. And biology is chaos. In biology, 1 + 1 does not equal 2. It never has been, never will be. That's why you need to understand the patient at the patient level, at the face level, at the arch level, lip level, at tooth level, and how to blend the whole thing to create that important dynamics of facial expression that complements your patient's dentofacial aesthetics. And that's dentistry.